HIFU stands for High Intensity Focused Ultrasound. Basically, this is a treatment which focuses sound waves deep into the prostate. Much like a magnifying glass would focus sunlight to a pinpoint, sound energy can be focused deep into the prostate to ablate or destroy the prostate and kill prostate cancer.
I did a lot of research, but I didn't find anything that showed me a better option. And some of the options I thought were not good.
HIFU is an exciting treatment for prostate cancer, really because of the quality of life side effects being very minimized.
The fact that it had such minimal side effects, and really, obviously, I believe that it'll address the problem. I believe it'll, take care of why I initially came here.
There are many quality of life issues, such as urinary incontinence, such as changes in bowel function, and certainly changes in sexual function, which often accompany traditional therapies. I'm excited about HIFU for my patients because those quality of life side effects are greatly minimized. And I think HIFU represents the best balance between treating the prostate cancer and maintaining that all-important quality of life.
The interaction with patients that we have typically starts with the patient realizing first that they've been diagnosed with prostate cancer. And then they will come through us via either their doctor, the internet, or telephone. We will talk to the patient. We begin the education sessions there. We send the patient information. We talk the patient through the different treatment modalities.
Since HIFU is an outpatient procedure, it's perfectly suited for treatments at our centers in Bermuda, Nassau, Bahamas, Cancun, and Puerto Vallarta, Mexico.
We start the process of looking at what location the patient wants to go to, what doctor the patient wants to be treated by. We match that up for them. We send them a confirmation packet which describes to them what information they need to gather for us in order to get them set for treatment.
The International Treatment Center in Bermuda is really a state-of-the-art hospital. The King Edward Memorial Hospital is a beautiful facility with state-of-the-art operating rooms and really a very well-respected, board-certified medical staff.
Well, the hospital is not unlike what you might expect from a hospital in Bermuda. Now, having said that and having interacted with the people that work there, the nurses and all the staff, they're a wonderful group of people. Really enjoyed that experience. They were just great.
After 36 hours, people are ready to fly back home. But many of my patients really decide to make a holiday of it, and especially in locations like Bermuda, will stay for an extended period of time to enjoy the surroundings of their recovery.
We drove to Savannah, Georgia first, flew from Savannah to Charlotte, and then Charlotte to Bermuda, 2-hour flight, unbelievably simple to do. And as you're coming into Bermuda, you see the gorgeous water off the coast. So just coming in here was a great experience. Then there was a driver to pick me up, and my wife, and our bags, took us right to the hotel, the Fairmont Hamilton Princess, which is where we're staying. It's a lovely hotel.
Once the patient arrives at the treatment location, the nurses facilitate for the patient. So we meet the patients. We meet with the patients with the patient education the night before their treatment, talk them through everything they should expect for the next day and the next couple of days post-treatment.
We had a meeting at 5 o'clock the day prior, and then we went out on the town, had dinner, just kind of enjoyed the scenery till pretty late that night.
And then we'll have our driver once again pick them up the day of the procedure and their family members and take them to the hospital. They will meet in a pre-op area with the local nurses there. The nurse will get them ready, and then the procedure will go.
The patient experience here is really first rate. Every need is attended to. The staff is caring, compassionate, and extremely qualified. I feel very comfortable with my patients coming to this facility, and they get care every bit as good as they're going to get back at the medical center in New York City.
The procedure usually lasts between 2 and 4 hours, and the recovery will last between 3 and 4 hours. So the patient's usually at the hospital for the entire day.
We stress to the patient in the education meetings that we would rather them focus more on getting an exact procedure, something that's going to be curative and complete, more than focusing on how long the procedure is going to take.
I remember the anesthesiologist explaining to me that something was going to feel cold in my hand, And that's the last thing I remembered. I think I woke up, a few hours later. I was going to the recovery room. I felt fine, really.
After they wake up from the procedure, our driver transports our patients back to their hotel where our nursing staff and the physician staff is staying. There's rarely any difficulties at all, but patients can be assured that we're on site with them during the recovery process.
If my friends ask me, I'm going to tell them that the procedure went great. I consider it to have minimal pain. I strongly believe that I'll have minimal side effects. The procedure was yesterday at 1 o'clock, and for the rest of the time we're here, several more days, we're going to go out and be tourists.
We welcome any patient to call us and talk to us about HIFU and come to beautiful Bermuda. Let us treat your prostate cancer and restore your soul.